Hi, my name is Rich Ellenbogen. I'm the chairman of neurological surgery at the University of Washington, and I'm the co-chairman of the NFL's Head, Neck, and Spine Committee. I'm here today to talk to you about returning athletes back to play and warning and danger signs of athletes who suffer concussions. The first principle that I want to bring to your attention is that youth athletes are different than professional athletes, and your approach should be tailored to every level of athletic play, whether it's pee-wee sports, high school sports, NCAA sports, or professional sports. Boys and girls, men and women are different. The youth brain is certainly much more sensitive to concussion than the professional athlete's brain. Youth athletes in general take longer to return to play than professional athletes. In fact, women athletes seem to take longer to recover from concussion than men athletes, and we're not quite clear why that is. But the approach needs to be tailored to the age, to the gender, and the specific sport. Number two, we must remember that return to play entails doing a good baseline exam on your athlete. Know your athlete. The fact of the matter is that by doing a good baseline exam on the athlete, you will be able to tell on the field whether your patient or player is concussed or suffered a concussion by comparing your exam on the field to that which you remember in the baseline. Number three, there are important facts to remember about your on-field exam. One is take your time doing the exam. It may take anywhere from 5 to 10 minutes to do an on-field exam of a player who is concussed. The reality is that by spending the time doing the exam, the patient's exam may evolve to the point where you can notice a deterioration in their exam. The danger signs are deterioration in their neurologic exam, change in their ability to think, their emotional ability, or their neurologic function, such as balance and any other part of that exam. If in doubt, sit them out. There should be no tentative approach to this problem. If a patient appears concussed, it is much safer to sit out a player than to put them back in the game and suffer the ill effects of a second concussion. It may take longer to return a youth athlete back to play than a college or professional player. In addition, it's important to remember that your sidelines exam is based on a baseline exam. It is important to have the athlete examined before the game or before practice, before the season, so that you have a baseline in order to compare them to once the player is concussed. Once the player is concussed, by remembering and knowing the baseline neurologic exam and neurologic function, you can make an accurate assessment on whether the player has been concussed or not. Specifically, knowing what their emotional, intellectual, concentration, balance exam is before the player suffers a concussion, one can accurately assess them on the field of play within several minutes. It's also important to remember that you should take your time when examining a player. It may take 5 to 10 minutes to examine a player on the sidelines after a suspected concussion. The rule of thumb is, if in doubt, sit them out. It is much safer to sit out an athlete than send them back into play and suffer the consequences of a second concussion.